This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly health news in review coming to you from the Health Broadcasting Service HBS radio channel. Hong Kong leader Carrie Lam called on residents to remain confident and support her administration's measures to contain a worsening COVID-19 outbreak as daily infections surged by more than 40 times since the start of February. Infections are still being reported in more countries and territories since the first cases were identified in China in December 2019. We will look at the current COVID-19 deaths and infections rates across the world. Let's begin with the first of our three randomly selected countries, Barbados. Barbados is at 42% of peak and falling at 722 infections per 100% people reported in the last 7 days at the time of this report. The average number of new infections reported each day in Barbados falls by more than 380 over the last 3 weeks at 56% of its previous peak. COVID-19 infections are decreasing in Barbados, with 296 new infections reported on average each day. That is 42% of the peak, the highest daily average reported on January 28. There have been 53,698 infections and 310 coronavirus-related deaths reported in the country since the pandemic began. Vaccination history. Barbados has administered at least 308,731 doses of COVID vaccines so far. Assuming every person needs 2 doses, that is enough to have vaccinated about 53.8% of the country's population. Next, let us look at Honduras. As at the time of this report, Honduras reports its largest number of new COVID-19 infections since the start of the pandemic, 14,900 cases. Honduras is at peak at the time of this report at 153 infections per 100,000 people reported in the previous 7 days. Honduras reports of new COVID-19 infections since the start of the pandemic stood at 14,900 cases. COVID-19 infections in Honduras are at their peak, the highest daily average reported, now at 2,142 new infections reported each day. There have been 406,872 infections and 10,641 coronavirus-related deaths reported in the country since the pandemic began. Honduras vaccination history. Honduras has administered at least 11,004,222 doses of COVID vaccines so far. Assuming every person needs 2 doses, that is enough to have vaccinated about 56.5% of the country's population. And the United States. The United States leads the world in the daily average number of new deaths reported, accounting for 1 in every 5 deaths reported worldwide each day. The United States is currently, at the time of this report, 11% of peak and falling at 189 infections per 100,000 people reported in the previous 7 days. The United States leads the world in the daily average number of new deaths reported, accounting for 1 in every 5 deaths reported worldwide each day. COVID-19 infections are decreasing in United States, with 88,789 new infections reported on average each day. That is 11% of the peak, the highest daily average reported on January 15. There have been 78,567,305 infections and 938,425 coronavirus-related deaths reported in the country since the pandemic began. The United States vaccination history. The United States has administered at least 549,939,423 doses of COVID vaccines so far. Assuming every person needs 2 doses, that is enough to have vaccinated about 83.8% of the country's population. Next, our attention will shift on to the continents. First, Europe. Britain will offer COVID-19 vaccines to all 5 to 11-year-olds, widening the rollout of vaccines in children in a decision that has been taken more slowly than in some other countries. And Americas. Top United States infectious disease expert Dr. Anthony Fauci said it is time for the United States to start inching back towards normality, despite remaining risks from COVID-19. Marriott and Hilton, 2 of the biggest United States hotel chains, told investors they expect people to resume packing their bags for business and leisure this year at rates not seen since before the pandemic. Japan is set to announce on Thursday that it will ease border controls put in place to counter the spread of the coronavirus, measures that are the strictest among wealthy nations and have been slammed by business leaders and educators. Finance leaders of the world's top 20 economies will debate the fallout from geopolitical tensions, global inflation, and tighter monetary policy at a two-day meeting kicking off on Thursday. But COVID-19 cases overshadow the gathering, with many ministers either attending online or skipping the meeting altogether. BioNTech has developed a vaccine factory made from shipping containers that it plans to ship to Africa as assembly kits to ease what the World Health Organization has described as huge disparities in COVID-19 vaccine access. Medical developments. An Omicron-specific booster could be ready by August, the CEO of United States biotech firm Moderna told Reuters, but the firm is still gathering clinical data to determine whether that vaccine would offer better protection than a new dose of the existing jab. Economic impact. Singapore maintained its forecast for the economy to expand 3 to 5% this year as the city-state's recovery from the pandemic slump continues, although officials flagged downside risks to global growth and rising inflationary pressures. The unemployment rate in Australia stayed at 4.2%, matching the lowest reading since 2008, when it bottomed out at 4.0%. The impact of the Omicron wave was felt most in hours worked, which slid 8.8% as employees stayed home sick or were forced to isolate. Japan ran its biggest trade deficit in a single month in 8 years in January, as high energy costs swelled imports and manufacturers struggled with global supply constraints, causing a decline in car shipments. Israel's economy grew at its fastest pace in 21 years in 2021 as consumer spending, exports and investment rebounded with double-digit gains following a pandemic-stifled 2020, raising the specter of the central bank raising interest rates soon. Norway's mainland economy grew last year by 4.2%, its quickest pace since 2007, as the country rebounded from a pandemic-driven slump in activity, data showed. We will finally again shift our focus on a recent development as Britain scraps all remaining COVID-19 restrictions. British Prime Minister Boris Johnson on Monday announced the government would remove all remaining coronavirus restrictions in England and cut access to free tests as part of its Living with COVID plan. The summary of the development are as follows. Bullet self-isolation law to be scrapped in England. Bullet end to free testing in April. Bullet Johnson bets on vaccines and antivirals. Bullet opposition Labour Party say moves come too soon. British Prime Minister Boris on Monday said he would end all coronavirus restrictions in England, including mandatory self-isolation for people with COVID-19 and free testing, drawing scepticism from some scientists and political opponents. Johnson's Living with COVID plan has sparked alarm that it is premature and will leave the country vulnerable to new viral variants, but the government says it has provided more testing than most other countries and must now curb the cost. The plan to ditch the remaining legal restrictions is a priority for many of Johnson's Conservative Party lawmakers, whose discontent over his scandal-ridden leadership has threatened his grip on power. Some critics think the plan is also a bid to divert attention from those scandals. Britain has reported 160,000 deaths from COVID-19, the seventh highest death toll in the world. As Hong Kong builds isolation units and Europe retains social distancing and vaccine rules, Johnson is moving to repeal any pandemic requirements that impinge on personal freedoms, saying it is time the public took responsibility. He will lean even more on the rollout of booster vaccines, with the government offering extra booster doses to the most vulnerable, as well as other pharmaceuticals interventions such as antiviral treatments. Restrictions pose a heavy toll on our economy, our society, our mental well-being, and on the life chances of our children, and we do not need to pay that cost any longer, Johnson told Parliament. So let us learn to live with this virus and continue protecting ourselves and others, without restricting our freedoms. Johnson said that the legal requirement to self-isolate for people who test positive for COVID would be removed on February 24, while free universal testing would end on April 1. The devolved administrations of Scotland, Wales and Northern Ireland have set their own COVID-19 restrictions, but the amount of money they have to spend on testing will flow from decisions made by the UK government. Scotland's First Minister Nicola Sturgeon was scathing on Twitter, writing, "To allow significant dismantling of the testing infrastructure built up in last 2 years would be inexcusable negligence given ongoing risks. Scale this back." Johnson said that some surveillance of the coronavirus will remain in place, allowing for a rapid response to new variants, which could be quickly scaled up. But he cited the much weakened link between COVID-19 cases and deaths due to vaccines, antivirals and the lower severity of the Omicron variant as informing his decision. "It is only because we know Omicron is less severe that testing for Omicron on the colossal scale we have been doing is much less important and much less valuable in preventing serious illness," Johnson said. "This came at a vast cost. We must now scale this back." Johnson said that symptomatic testing would remain available for at-risk groups and social care staff, and would work with retailers to allow anyone who wants to buy tests. Britain has been unusual in providing free lateral flow tests to people who want to for months. In contrast, US President Joe Biden offered limited free rapid tests to households for the first time last month. Leaders in Scotland and Wales had criticised Johnson's plans to reduce the availability of testing ahead of the announcement, while leader of the opposition Keir Starmer also said that the plan was ill-conceived. "We can't turn off Britain's radar before the war is won. Ignorance is bliss is not a responsible approach to a deadly virus," Labour Party leader Starmer said. Here again, in a nutshell, is the sum total of the changes announced. Isolation. From February 24, the legal requirement to self-isolate following a positive test will end. Adults and children who test positive will be advised to stay at home and avoid contact with other people for at least 5 full days, and then continue to follow the guidance until they have received 2 negative test results on consecutive days. Workers will not be legally obliged to tell their employers when they are required to self-isolate. Self-isolation support payments will end. Routine contact tracing will end. Fully vaccinated close contacts of positive cases and under 18s will no longer have to take a test for 7 days. Close contacts who are not fully vaccinated will no longer be legally required to self-isolate. From April 1, people with COVID-19 symptoms will be encouraged simply to exercise personal responsibility in same way as those with flu will be encouraged to be considerate of others. Testing. From February 21, the government is immediately removing the requirement for staff and children in most education and childcare settings to undertake twice-weekly asymptomatic testing. From April 1, free symptomatic and asymptomatic testing for the public will end. Routine contact tracing will end. Fully vaccinated close contacts of positive cases and under 18s will no longer have to take a test for 7 days. Close contacts who are not fully vaccinated will no longer be legally required to self-isolate. From April 1, people with COVID-19 symptoms will be encouraged simply to exercise personal responsibility in same way as those with flu would be encouraged to be considerate of others. Testing. From February 21, the government is immediately removing the requirement for staff and children in most education and childcare settings to undertake twice-weekly asymptomatic testing. From April 1, free symptomatic and asymptomatic testing for the public will end. Limited symptomatic testing will remain available for a small number of at-risk groups as well as for social care staff. The government is working with retailers to ensure everyone who wants to can buy a test. Certification. From April 1, the government will no longer recommend the use of voluntary COVID status certification. Vaccines. A spring booster vaccine will be offered to over 75s, care home residents, and over 12s who are immunosuppressed. The Vaccine Task Force will continue to ensure UK has access to effective vaccines as they are developed. New variants. The Office for National Statistics survey will be maintained to allow to continue tracking the virus with regional and age breakdowns to spot surges. However, England's Chief Medical Officer Chris Whitty warned on Monday there will be new COVID-19 variants and said some of them could be more resistant to vaccines. Earlier, Britain said it would end all coronavirus restrictions in England, including mandatory self-isolation for people with COVID-19 and free testing, drawing skepticism from some scientists and political opponents. "We all expect there to be new variants. And some of those new variants will just disappear," Whitty told a press conference. "But some of them will cause significant problems. There is so much to think about in this report." On that note, we round up this week's episode of our weekly health news in review. We will be back with more reports next week. Please remember to press the subscribe button below to stay abreast of vital and authentic global health news and related developments from the Health Broadcasting Service. Stay safe, and bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.